The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, Dr. Tom Roselle here. Welcome to Ageless Health live stream with yours truly, obviously. And we're going to get into another topic that I don't think many of you really can appreciate, and most of the guys that are in this world appreciate. But we're talking about back pain, but we're talking about it from a different perspective, something that triggers low back pain. And it has to do with something that is away from it. What are we talking about? We're talking about temporomandibular joint dysfunction, TMJ. Now, you're sitting there saying, what? How come? How many times, those of you who had back pain, those of you who've, in 80% of the world, obviously, is going to have some sort of back pain at some sort or at some time. And how many of you go to the doctor and the doctor asks you a question that's similar to this? When was the last time you had a dental appointment? Have you ever had braces put on? Have you had any extensive dental work like caps or fillings or implants or braces or anything like that? I would guess to say that very, very few would ever have that question posed to them. But it's one that's extremely critical because so much back pain never resolves itself because the temporomandibular joint is not aligned properly, doesn't work the way it's supposed to. Now, why is that? Why is there a relationship between those two areas? I mean, we know silly things, not really silly, obviously, that dental infection can cause a tremendous amount of damage in the body, particularly with the heart and other areas that we know about today. And every tooth in the mouth has an organ system and has a spinal level that it relates to. So, for example, if you have a problem with the central teeth, the top two, the bottom two, that relates to organs of reproduction. It could be your fight-flight system, your adrenal system. It could be your ovaries. It could be the testicular area for guys and so forth. So we have to begin to correlate. But what does the temporomandibular joint have to do with low back pain? A lot, as it turns out to be. Over the years and the decades that I've been in practice and the thousands of patients that we've seen, here's the correlative. Many patients will come in and they'll say, I don't know why my back is bothering me. I've never had problems before. And when you look at them, they're in fairly decent shape. Their bodies aren't overweight. They eat fairly well when you go through the history, but they have this sudden onset of low back pain. They don't have constipation. They don't have diarrhea. They haven't had an infection. They haven't had any kind of trauma. There wasn't even a slight bump, but now they come up with this back pain that just doesn't seem to want to go away no matter what they do. They've been to other doctors. They've been to chiropractors and osteopaths and physical therapists and medical physicians, and nobody seems to come up with the fix because the wrong questions are being asked. And I don't mean that they're not related possibly to the problem, but the problem is that they're not related to this type of low back pain. So the question becomes, hey, listen, have you been to the dentist, within the last, you can put up with the years because you already know that this problem's been there maybe for a year or 10 years or 15 years or whatever. So you got to trace it back to the very first time it takes place. So the very first time could have been, about a month after or 4 days after or 6 months after a dental appointment that they did a lot of work. And that lot of work could be putting braces on, expanders. They could have put in fillings. Most dentists were trained back in the day to match the dentition, the vertical dimension of your teeth, not the temporomandibular joint. And you've heard me talk about that before. If the temporomandibular joint is not aligned properly, it has a profound effect on multiple systems throughout the body. It'll affect the cranial plates because they jam up into here. They're actually this joint space, this temporomandibular joint, and the lower part of the jaw, the mandible, is lovingly called the pump handle of the skull, of these 22 bones that make up your head. So if this isn't sitting properly, then the cranial plates, the 22 bones that make that skull of yours the way it is, aren't going to move properly. And it has a profound effect in multiple systems. But one system is the low back. The temporomandibular joint itself, this relates directly to the pelvis and the sacroiliac joint. You know, the sacroiliac joints, you know, the big hip bones, and then it goes back like this. And in the middle, you got this wedge-shaped bone. It's called the sacrum. Well, the joint space is called the sacroiliac joint, and they come together. Well, if this is not aligned properly, then that lower pelvic area is not going to be aligned properly. And as you walk and as you move, there's going to be an obvious distortion that's going to be noticeable. And if a doctor's really watching and trying to diagnose a low back problem, the first thing they're going to do is they're going to have you stand up and they're going to have you walk. And they're going to have you take your shoes off and walk. And they should be observing postural dysfunction. But mostly when they have a chronic condition, they have to ask those questions about dental treatment, last cleaning that you had, and so forth. You know, think about it this way. How easily is the temporomandibular joint distorted or disturbed? Well, in my world, one of the things I'll ask the patient when they come in is when you went to the dentist and you had that cap put in, you had that filling put in, you know, that little carbon paper they put in your mouth and they go tap, 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 grind, 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 back and forth. Did they do it while you were sitting or standing, or did they do it when you were lying down? Well, if you're lying down, it increases the risk of distortion of the temporomandibular joint. Their job, as they're taught, is to make sure there's no irritation and it doesn't cause an aberration in closure or opening. But it doesn't mean that it's sitting properly. Sometimes it's too high, it slides in a different position, and immediately distorts the position of the TMJ. Once that happens, the whole body is going to compensate and adapt. And the area that it goes to in a maladaptation pattern first is going to be the sacroiliac joint and the low back area. Now, if you've gone to your doctor and they've given you pills, they've sent you for therapy, you've gone to good meaning chiropractors and osteopaths, and they try to align your spine properly, which is appropriate, which is necessary to take the pressure off the nerve roots as they exit from your low back, but also getting the muscles to balance, it will not stay in position if the temporomandibular joint is not aligned properly. I have a young patient, a couple quick stories. One that came in to see me, and she had expanders, and she had a genetically shortened lower jaw, genetically shortened mandible. So they went, when I think she was about 9 years old, 10 years old when it started. Now she's about 18, 19 years old. What they did is they forced with bracing to pull the jaw forward like this. What took place is that she ended up with a major spinal curvature because of the maladaptation that occurred. This was forced. And the temporomandibular joint, which is a saddle like this, and the upper portion sits into that saddle. One of the condyles, as they called it, was flattened out because of the distortion pulling forward. And that happens, unfortunately, too regularly if it's not done properly. You have to make sure that your dentist understands that they have to balance the temporomandibular joint first before they balance the dentitia. Now, there's several schools of thought out there when it comes to the temporomandibular joint in the dental profession. One is an area called LVI, Las Vegas Institute, and they're very well known throughout the world. And the other one is Pankey Institute. And there's a couple others. They're getting the idea now, but over the years, you have to take that consideration of what was done, when it was done, when the back pain started, and the progression over a period of time. Now, what I want you to understand is that that low back pain of yours is not going to go away unless the temporomandibular joint and the upper portion of the skull is aligned properly. Why? because of what we just talked about, because the correlation between one part of the body and the lower part of the body as well. Correlatively, every joint in the body has a cousin or a brother or a sister that it works with. What do I mean by that? I mean, it's like your right shoulder and your left hip, your left shoulder and your right hip, your elbow and your knee, your wrist and your ankles. That's the gait mechanism. That's how you move. So you have to look at all of these pieces to see the normal positional pattern of the body. Sometimes a little distortion in, let's say, your ankle bone can cause a major shifting all the way up, and it can affect your low back. It can affect your spinal system. It can affect your neck and shoulders, but it goes in the opposite direction. That's why we're talking about the temporomandibular joint, because most doctors forget about it, or they don't think it's that important, or they set it aside. In our experience over a period of time, this joint space is critical. Temporomandibular joint is critical in the alignment of the spinal mechanism. When I was first in practice many years ago, there was a young girl that came in. I would treat her family pretty much on a monthly basis to maintain their health with good chiropractic care. And in those days, dental bracing wasn't the thing, right? So she wanted to hide for a few months, so she got used to it. She was going to go to have the braces put on after she saw me that day. And this was a girl who was like somewhere, I remember, 11, 12 years old. She was a tremendous gymnast, beautiful, straight, muscular spine, beautiful, mechanism that said, yeah, wow, that's great. So she goes to the dentist that day. He knew he was going to see her for a while. So he puts braces on a little tighter than he normally would do. And he gave her some medication, said it might be a little sore. So I didn't see her again for 2 months. When she came back in, she had a 27-degree spinal curvature. There's no family history of it. There wasn't a trauma during the summer, nothing. The only thing that was there was the alignment or misalignment, if you will, because the braces, the dental bracing, causing the body to adapt, and that scoliosis, that spinal curve showing up. Can it happen? It happens all too often, unfortunately. So obviously I'm young in practice. I think it was probably my third year of practice. And I'm saying, oh my gosh, what's going on? So I picked up the phone. I called a very dear friend of mine at University of Buffalo Dental School, a guy by the name of Dr. Mike Marfino. Mike was a very well-known at the time specialist in temporomandibular joint. And I called him and I told him I'm panicking a little bit. And he said, just remember what you know, how the body's injured. Send her up to me. I'm going to take the braces off. They put them on too tight. Fortunately, with treatment, with him knowing at that time what needed to be done, and the work that we did with cranial work and rebalancing the spinal system, within about 100 days, that 27-degree curvature went back to normal. So we're talking about muscular maladaptation due to other processes not being normal. That process, that other anatomical structure, is the temporomandibular joint. So think back with your low back pain. If you've had a problem for a long period of time in your low back, and you've been to some really good people, and they haven't been able to figure it out, I would encourage you at that point to think through the process and see if you've had any kind of dental work. And then after that dental work is when the problem started. And you didn't think too much about it. Sometimes it's insidious, it's slow, it's there. And then all of a sudden, it's chronic. It doesn't go away anymore. That could be the underlying triggering mechanism. You have to get to see people like my team. They're great doctors. They're all based in applied kinesiology. Dr. Harlan Browning and I will do a presentation coming up very quickly on the 16th of this month. And we're going to be talking about this condition, low back pain, chronic, from a lot of different perspectives. We're going to talk about dietary perspectives, your feet, cranial distortion. I'll start talking about temporomandibular joint. It's critical. It's important that you understand that it's multidimensional. It's not about taking a drug. It's not about just getting some therapeutics. Some of you deserve your low back pain because you have over-endowed waistlines. You've worked really hard at putting those together. You just start shoving things in without thinking of the consequences. or the only physical activity that you're getting is a remote control. You're sitting there and you're clicking and clicking and clicking, or you're on your phones. You got one eye on the screen, you got another eye on your phone, you're playing your games, but you don't do anything. So the body begins to break down over time. Now, once you like to do something a little different than suffer with pain, and you get to the place that you don't want to get up anymore. I'm treating a gentleman, a great guy. He's about 80 years old, 81 years old, and you wouldn't know it by looking at him if he wasn't complaining all the time. But he's got significant back pain. This was a guy that was a power lifter up until about 15 years ago. And all of a sudden, he can't walk anymore. He's on canes. He's on all kinds of things. He's got degenerative disease in his spine. They've told him, this is wait a. He came in, he couldn't even get on the table. So I had to do a lot of treatment in a seated position and the things that we're doing. Now, and literally about a month later, 5 weeks later, he can get on the table by himself. He's still complaining. He's a curmudgeon. And if he's watching this, you know who I'm talking about, and I love you anyway. But he's responding. He's getting better. So here's a guy with advanced spinal stenosis that came in on cane, could barely walk down the hallway, and was morosing the fact that that's all he had left in his life. He's sharp as a tack. He's an amazing man. He's a lot of fun. When I kind of poke at him, I get the responses that I want. But he's improving. And I said, you got an opportunity here. You can decide to get really better over time and get your life back so you can start doing things that you want to do. Or you can sit in that chair and complain and bitch about everything that there is to complain about. It's your choice. What do you want to do? I don't know about anybody else, but for this guy, and many of you know my history and so forth, I'm not taking that way out. I'm not taking the drugs. I'm not taking, the diagnosis that, well, what do you expect for your age? I'm not taking, the directive said, well, you got to be careful. You got to do this. I want to do whatever I want to do when I want to do it. And I keep looking for other ways to constantly enhance what I get done. This coming 2 weeks from now, I think, it's 2 weeks coming up, a week and a half. On the 16th, Dr. Harlan Browning and I, the professor, many of you know him and know him well. He's brilliant. He's an amazing, amazing guy. We'll be putting together different pieces of that low back puzzle so you can really get it together. You can understand it, and you can take some action steps. And we'll give you an opportunity, as we always do, if those of you who attended our in-house classes, to come in for a consultation examination at a very reduced charge with Dr. Browning. And because when I say this man is a genius, he is brilliant. He's unbelievable. He gets it fast. He knows how to put it together. And we have a great team. When you're dealing with any kind of intimacy within the body, what I mean by that is one piece relates to the other, It's not just a localized situation. You need people who understand those pieces. And the people that understand it best are people that are trained, like our team is, in applied kinesiology, which is our specialty. And that means that there's an interplay between different systems of the body. So, for example, if you will, the muscles of the low back that start from your pelvic area and they kind of cascade up like this all the way to the top of your shoulders, they have a direct relationship to calcium metabolism and bladder function and so forth. The muscles that make up your buttocks, right, that hold you upright, because if your butt muscles aren't working and you're going to fall forward, you can't stand up. So when you see people bent over, it's often because the buttocks is not firing. Well, you have the nerves from the low back that go there, but you also have the connection to the organ systems that are of reproduction. That's right. The buttock muscles relate to the organs of reproduction. Isn't that cool? Again, that's that organ muscle phenomenon. People ask me, how does that work? What does that really mean? But nobody else talks about it. Well, brain, spinal cord, right? And so your computer system, your coaxial cable, then your peripheral nerves that go out, your tie-ins. Well, you have 31 pairs of nerves that come off the spine. And what they do is they divide. One branch goes to muscle, the other branch goes to the organ system. So they're constantly talking to each other. Now, you have joint spaces that we just talked about: temporomandibular joint, sacroiliac joint. You have the mechanism of the skull relating to different parts of the hip. In the mouth, way back here, hinge muscle on either side, there's muscles called the pterygoid muscles. The pterygoid muscles, if they're too tight, lock your pelvis in. They will not allow the leg to abduct properly. It locks it very minimally. So you're on your back, and the way we test it, you're flat on your back. We'll take the leg, we'll bring it out to the side. And if it's restricted, we know that the temporomandibular joint is not aligned properly. And it's often simply because that pterygoid pocket is too tight. So what we do, the pterygoid pocket, if you kind of visualize like your hand like this, we'll go in and we'll put a glove on and just lightly touch it. And then we put a percussor on the outside of our hand. And what that does, it sends an impact stimulation to the muscle and relaxes it completely. And the hips, guess what happens? All of a sudden, from no abduction, full range of motion, full abduction, and often that's all it takes to fix the low back, to fix the pelvis, to fix the sacroiliac. And it's amazing. It's mind-boggling. It almost looks magical. Would you like to see that? Join us on the 16th, and I'll demonstrate it. I'll show you what takes place, because it's one of the most profound, amazing, right now, observable treatment processes. So I'll get somebody that I know that's messed up. I ask permission. Will you let me do this? I'm not going to hurt anybody, but you're going to see something that you probably wouldn't believe otherwise. So call us, 703-698-7117. That's the old-fashioned way at the Roselle Center in Fairfax. Make a reservation. The only thing we ask you is make sure that you call us and say, I can't make it. If you can't make it, and it's okay, because our gift to you as a community. Or you go to drtomroselle.com, or you can go to rosellecare.com and register for the class. Would love to have you there and join us. I promise you it'll be a great night. You'll have more information than you know what to do with. But the most important piece is that you're going to go away with knowing why something is happening. Number two, how to protect yourself, and things that you can do ongoingly to avoid pain and disability and dysfunction. And because of that, guess what? You live not only longer, but you're going to live a life that you want to live, instead of living one that's impaired and disabled and starting to adopt the attitude of, what do I expect for my age? Again, I don't know about you, but I'm trying to make it better and extend it as long as I can possibly extend it. So join us on the 16th. We're going to have a great time together. I promise you it'll be a night that you're going to have a tremendous amount of data to take with you. And I'd love to meet you. I'd love to shake your hand. I'd love to answer any other question that you may have on your health. We'll do that as well. So you could say, hey, could this problem that I'm having with urinary dysfunction be a result of my low back? Possibly, because the nerves go there. Could it be that, my doctor tells me that I've got irritable bowel, but my back has been killing me. And they're telling me, well, it's just reflexive to my low back. Maybe, but it could be the other way around too. It could be your low back that's causing the problem. If that's the case, wouldn't you like to get rid of it, or know that there's a reason that it's there, or know that there's a way of walking through that fire and permanently putting the fire out? I don't know about you, but join me on the 16th. We'll have some fun. I promise you're going to have two guys that are going to go back and forth, and we're going to play off each other. But more importantly, we're going to serve you at the highest level possible. The 16th, Wednesday night, 6 p.m. The weather's still great. Join us. And remember, I'm here on an ongoing basis. One, to give you as much information as you possibly can, but more importantly, because you deserve it, I love you all. You have a great day. We'll see you on the 16th. Bye.